I played volleyball, soccer, golf, swimming. I got sick in December 2009. I had flu-like symptoms for about a week. They went away. I was living in Chicago at the time. I then had a sore throat. That really wouldn't go away, so I went to the doctor's office. They put me in antibiotics. It still didn't go away. I went back to the doctor's office. They checked me for mono. I didn't have mono. And then it went away. Then a little while later, I lost my voice. Then it went away. So it was just a bunch of little different symptoms. I started getting swollen joints, and when it became a major problem was probably in May of 2010. My knees were so swollen that I couldn't like crouch down in a catcher's position kind of thing. It got worse. I couldn't, as it progressed, I couldn't get out of bed. I wouldn't be able to lift up my arms. At one point in time, my left joint had gotten so swollen I could not get my hand to my face to brush my teeth or comb my hair. So I went from a normal 31-year-old to pretty bad state, I guess. I didn't know what was wrong, and the doctor I was seeing was treating me for arthritis and said, I definitely had an aggressive type of arthritis. He wasn't sure what was going on, so he put me on medications. But then that summer, I started getting fevers. I would get home from work around 6 o'clock and would start to get chills, and my fevers would get up to 103, 104, and I would get them every night, and they would break, and I would have night sweats. I would wake up 2 or 3 times a night and have to completely change my clothes, change my bed sheets. If I wasn't able to change my bed sheets, I would just put down a towel and sleep on a towel. So that's when it got really bad. I saw an infectious disease specialist. I saw a hematologist. They were referring me to all sorts of doctors. Chicago's got some pretty good hospitals and some pretty good doctors there. So I felt like I was getting good treatment. And what got me to Mayo actually was I found out I was going to have my hips replaced in October. And so I started looking for surgeons. Had seen a couple surgeons in Chicago. And then my mom and dad had encouraged me to go to Mayo. My surgeon that I came to see up here, Dr. Taunton, he sat down, talked to me for a long time about my hips, but said he wouldn't even consider operating on me until we figured out what was going on internally and what the disease was. So he then set me up with a bunch of doctors here that whole week. I thought I was just coming up to see the surgeon, and then ended up going to another infectious disease doctor up here, and then on to my rheumatologist, Dr. Baumgart's, and he's the one who diagnosed me and figured out what was going on. Adult onset Still's disease. It's very, very rare. Essentially, my immune system is attacking my joints. Once it's diagnosed, there's definitely treatments. They say it's not curable, but you can live a normal life again once you get on the proper drugs. It was amazing. Like I said, I was getting great treatment in Chicago, but Mayo is just a world above any other medical treatment I've been getting. Just the doctors, their patients, they sit down and speak with you for about an hour if they need to, or longer or shorter, and go through everything with you, and they're just phenomenal. This past May I had my right hip replaced, and then in August I had the left hip replaced. As far as having my hips replaced, I can do everything I was doing before, except for running. They don't want me to run or do any like high impact sports. As far as the disease, I guess it's my understanding that some people it'll go away on its own, and you can just come off your drugs and be fine. Some people will have to stay on these drugs for the rest of their life. Even if I just have to do the infusion once a month, I'm able to live a healthy life, so it's fine. It's a small price to pay. It was very challenging when you didn't know what was wrong with you. You didn't know what to do to fix it, or there was nothing you could do. And now that I have an answer, and I have plans and steps for the future, it's great. I'm able to travel now. Before I was in a wheelchair if I had to travel, and I had a cane, and so travel's much easier now. I can't speak highly enough about Mayo. Anybody that has something going on, they don't know what's going on, I recommend it all the time. Even the surgeons that I had seen in Chicago, I mean, we probably weren't at the point, but they didn't talk about, well, I'm not going to operate on you until we know what's going on with you, or I want to figure out what's really going on with you before we talk about replacing your hips. I mean, there was none of that with those surgeons, whereas that was the first thing my orthopedic surgeon said here. Because, I mean, if we hadn't figured out what was going on, they would have operated, then, you know, I probably would have had my knees replaced by now, and who knows what other joints would have already deteriorated. And it was little things. It wasn't even, you know, you think about, okay, well, I couldn't golf anymore, I couldn't run anymore, but, I mean, I couldn't clean my house, I couldn't. It was hard to bend over and, you know, put your shoes on. I mean, it was just little things. So you appreciate the little things. Be able to walk. I feel like I did before I got sick. I'm healthy again. I'm able to do all the things I was able to do before I got sick, and I have my life back.